morning. Good to have you with us in this edition of the Urban Debate tonight. One more time, as we have over the last 6 months, we put the spotlight on coronavirus. And if there is a reason for us to worry a little bit more than we were, if there is a reason for us to relook at the way we are living our lives, if we've let our guard down. Because viewers, one thing is clear, India is seeing a spike in its cases, a sudden increase in its cases, and especially in the last 10 days, and we need to talk about it. We need to talk about the fact that on a daily basis now, we are registering 90,000, over 90,000 fresh cases. Over 90,000. Imagine, if this continues at this pace, by next week, we will be registering 1 lakh cases every day. Currently, we have about 8.8 lakh active cases. But the number is increasing. The cities like Delhi, Mumbai, Chennai that seem to have gotten a hold on the situation, that were beginning to bring down things under control, are now seeing a spike again. And lots of other states, big states, are also struggling. Quick look at some of the number crunching that we have done and what it's really showing for us. In Maharashtra, for example, the daily cases have gone up by over 100% than what it was a month ago, even though the testing has only gone up by 22%. So it's not simply a case of that we are testing more and so we're getting more cases. Something's going wrong again in Maharashtra. In Delhi, the doubling time, the time that it takes to double the cases, has come down by 52% in the past 1 month. The daily positivity rate has gone up for Delhi, for Maharashtra, for Andhra Pradesh, Kerala, Chhattisgarh and Haryana. Some of the states that are showing worrying signs. Daily positivity rate has gone up for these states. And the reproduction number, which is the R0, that shows you how fast the infection is spreading, is also going up for Delhi, for Maharashtra, Haryana, Himachal Pradesh, Jammu and Kashmir, and a few other states. What is going wrong is the point of conversation tonight. I'm going to go quickly across to the India's top doctor, AIIMS director, Dr Randeep Guleria, joining me right now. Dr Guleria, thank you so much for speaking to us here on Mirror Now. Dr Guleria, in some of your recent interviews, you've said that you see a second wave of COVID in parts of our country. Now, help us understand, what does that mean, the second wave that we are witnessing?
So in some parts of our country, we had seen a significant decline in the number of cases. One classical example is, of course, Delhi, where the cases have come down to less than 1,000 per day. And now again, we're seeing a resurgence of cases because of multiple factors. It could be related to increased testing. It could also be related to people having what I call COVID appropriate behavior fatigue, and thereby not being as vigilant as they were in the past. But the number of cases now has again gradually started increasing in those areas where we had a good control of the pandemic. And in Delhi now, from less than 1,000, we are seeing close to now 3,000 cases. So that is a cause of concern, especially because we are moving into the festive season where there will be more crowds developing and mixing.
So if I really look at some of these cities, like you said, for example, Delhi, you said, the things have become worse, which is what the data also shows, even though the testing hasn't gone up by so much, but the cases have. Maharashtra testing only up by 22%, but the cases are up over 100%. So it's clearly not just a factor of testing, it's more. There are multiple factors involved here. What should our response be to this situation now, Dr. Guleria?
So I think we need to look at it from the point of view of what can we do. First of all, we have to now accept the fact that as the economy opens up and as the lockdown becomes less and less, there will be more movement happening of people, and people will have to, we'll have to ensure that they maintain the strict norms that we have been insisting on in terms of physical distancing, wearing a mask or hand washing. When the pandemic started and in the early days, especially when the lockdown was there, people were very, very careful. And this was something that they did very sort of religiously as far as these measures were concerned. But now if you look at it, there is a little bit of COVID behavior fatigue and people have now let their guard down. And this is what the virus actually is waiting for. The virus actually waits for people to start coming out of their own lockdown, and that helps to spread the infection. So I think we need to work on a strategy of how do we revitalize, re-energize people to go back to an appropriate behavior. How do we develop strategies where we keep this in mind that people will behave like this, and still how can we develop strategies of containing the spread of the infection, developing good amount of testing, tracking, treating, and isolating facilities, even when this behavior is there. And as we start sort of living with COVID as the economy opens up.
So the lockdown was primarily, Dr. Guleria, to get our policies in place, to get our health infrastructure in place. Now, do you believe now as we unlock, and I am not an advocate of locking down again and again. I believe we have to at some point, get back to the lives the way they were. But as we unlock, do you believe our health infrastructure is ready to take on this additional load?
So as we've started sort of unlocking ourselves, there is obviously going to be a spike in cases. What the advantage we had of the lockdown was that we were able to build a lot of capacity. One was capacity for testing. If you remember that during the early days of the lockdown, we were doing less than 10,000 tests a day. We had very few labs. We have now more than 1,400 labs, and we are doing more than 1 million tests a day. So our testing capacity has increased tremendously. Similarly, we had very limited COVID dedicated facilities. We've then built COVID care centers, COVID hospitals, COVID ICUs. We had shortage of PPEs, which are now in surplus. We had ventilation and oxygen made available. So a lot of work was done. But as the pandemic progresses, we have to continue to work in doing things in a manner that is dictated by how the pandemic behaves and how the virus behaves. So you may have areas which see a certain spurt in the number of cases. A strategy has to be developed in how do we contain it, how do we develop aggressive containment areas, and how do we increase our health infrastructure to manage the increasing number of cases if they come in that area. So that strategy it's an evolving strategy. It's not something that is so you prepare for everything, but at the same time your preparation goes on as the pandemic evolves.
Dr. Guleria, we saw, individual cities resort to a kind of a micro response where you were only talking about containment zones, containment buildings, or even containing a floor if there were cases. Would you suggest a change in that kind of a strategy now? What do we do?
To look at strategy, because our initial strategy was more based on larger cities where we had areas which were very densely populated. But as the pandemic moves to smaller towns, it moves to rural India, we'll have to look at a strategy. For example, in rural India, the population density is not that much in one given kilometer. People still are scattered around, and the chance of infection is less. But we will have to develop strategies that there is less mixing when it comes to, let's say, a market, or when it comes to a social function. And we will have to be aggressive in preventing crowding, because crowds are where there can be a huge amount of spread as part of a super spreading activity. So these are things that we will need to develop as new strategies in smaller cities and in rural India.
Dr. Guleria, let me ask you this as a layman. Markets have opened. People are stepping out, not just for work, but even for, regular shopping, going to the markets, going to the malls. Now there are shopkeepers, there are staff members, workers, there are the shoppers who are all there together. Is wearing a mask and just sanitizing your hands enough? We're going to be touching the same things, surfaces, objects. Is just this kind of a precaution going to be enough?
So now there's a lot of data, and this data is based on large number of studies and meta-analysis, which suggests that 3 or 4 things are very, very important to protect you. One is everyone wearing a mask, the person who is infected and the person who is not infected, so as to prevent the chain of transmission. So that is important. But when you're talking of a mask, you must wear it even while you're talking. People will take their mask down while they're talking, which is not acceptable. And the mask should cover both the nose and the mouth and be fit tightly around your face. Second is regular hand washing, whether you're using a hand sanitizer or using soap and water, and trying to maintain physical distancing. The third thing that is also, the fourth thing which has also come out as an important part is that if you're indoor, there has to be good ventilation, because there was this whole issue which came up by certain scientists that there is also what we call aerosol transmission of the virus. And to prevent aerosol transmission, which happens more in an indoor environment, there has to be good cross ventilation. So if you're going into an indoor environment, it could be an office, it could be a mall, there has to be good circulation of fresh air coming in by opening a window, by having an exhaust, keeping your door open, so that there is good cycle or cycling of air, and fresh air comes in and air in the room goes out, and with that the infection also goes out and chances of infection come down significantly. And that is the steps that we need to take.
My last question to you, Dr. Guleria, and this is to do with, the in recent instances of reinfection that we've seen. There was one case in Mumbai, another one has now come out in Bengaluru, and the gap is not too long. The COVID patients who had recovered again got the infection in just about a couple of months. Now, how do you view this, and should we be concerned?
So I think there are two things. One is, how common is reinfection? When the pandemic was in its early stages, there was this huge issue of reinfection from South Korea. But it was shown then that it was not reinfection, but some people, especially whose immunity is low, continue to shed the virus for a number of weeks. And therefore, they may become positive after a few weeks, which is the virus which is being shed from the first infection itself. But having said that, there are not documented reports which have shown by looking at the genetic material of the virus that people have had two separate infections over a period of time due to COVID-19. It's not a very large problem right now, but it may become significant with time, and it's a cause of concern because it shows that maybe some people don't develop that much of immunity as others are, and that may predispose them to reinfection. There is data which suggests that in people who have mild infection, or who are asymptomatic and develop the infection, the immune response is weaker and they develop less immunity, which lasts for a lesser period of time. But we need more data for that, because immunity is dependent not only on the antibodies, but on what we call cell-mediated immunity, which is also T cell immunity. And this is bearing also on the utility or the efficacy of the vaccine. Because if we are having antibodies which are being produced for a short period of time, that means the vaccine may be also effective only for that many months, and we may have to revaccinate to get good immunity. So I think we need more data, and we need to follow up these patients closely to see what was the reason if they did get reinfection. Was it related to immunity? Was it related to mild infection? Was it related to some other factors which decrease their immunity, which could be drug related? And that is something that we need to look at.
Well, that's definitely concerning, because, if you're going to be looking at a vaccine that doesn't really solve the problem in one go, and we will need to keep taking it again and again, then that's going to completely change the way we view this disease. Dr. Guleria, a pleasure to have you with us. Thank you so much for joining us. I know you've had a busy schedule, but thank you for speaking with us. Let's, without wasting any time, quickly open this up for conversation as well. We've got top doctors, from across the country joining us right now. We've in fact even got a big expert joining us all the way from United States to discuss the India situation right now. Dr. SK Sarin, Director for the Institute of Liver and Biliary Sciences, joins us this evening. Dr. Vijay D'Silva, Director for Medical Affairs and Critical Care, Asian Heart Institute, joins us this evening. Dr. Gautam Bhansali has been with us on several shows earlier as well. He's with the Bombay Hospital and also a member of the Maharashtra Task Force for COVID-19. And Dr. Brahman Mukherjee, Professor for Epidemiology, School of Public Health at the University of Michigan, joining us this evening as well. Thank you to all of you. Dr. Sarin, let's begin with you. Let's talk about why this jump in cases that we are looking at right now. To your mind, is it simply because we've sort of let our guard down, we've started to step out, a lot of people are not wearing masks, not following social distancing, things which are essentially under our control, but we're not following the rules?
I think one of the reasons I feel is increased number of testings, and Delhi has almost doubled the number to 40,000 in last 1 week. So the proportionate numbers have increased. But there is no denial that the numbers have increased, and they are worrisome because there are more deaths now. So all of us need to be cautious and careful. The asymptomatic cases generally are not noticed, and they are the ones I think they are spreading much more in the community than the symptomatic. You remember the days when they were symptomatic, everyone was brought to the hospital, so we knew who is to be not contacted. So today, more important part is to be aware. I would think a strategy we have to evolve now could be decentralizing. And decentralizing is any office, any place where people are going to be more than 10 or so. They should set up their own place where they can do their testing. Why should it only be hospitals and others? I'll give you an example. In last 1 week, Delhi hospitals have started testing everyone who is going to the hospital, every OPD patient and the contacts. And this has immensely helped us. Like today, 35 new people were found who had no symptom. They were standing in the queue. Now, if these 35 were there, they would have spread maybe to another 35, and they would to be another 35. So my suggestion is that we should be doing testing at our own level. We can create those spaces, we can create those facilities. Secondly, we also must remember that the wearing of mask is the only way of preventing. And people forget it, especially when they are eating. So I think it must be banned that you eat except at home. Don't eat in public together. And if you have to turn your face to the other side, also don't touch your eyes, don't touch your ears too often. Mask covers nose and the mouth mucous membranes. It doesn't cover the mucous membranes of your eyes and ear. So for them, remember, repeated hand washing properly and not touching them. And the best way is to educate, educate, and educate. There is no shortcut than this. I have a fear that in the days we are just seeing this surge, but it can become worse. And as you said, we can cross 1 lakh. But the worst part can come maybe another month. So September is the month where everyone in the country, every citizen must say, we will work hard to contain it. And if you have by any chance made a mistake of not be properly wearing a mask, exposing others, you should do Kshama Yachana. God forgive me, my city, my country, my fellows, please forgive me. There's a Kshama Yachana Parv. So don't make that mistake that you expose others and get exposed. So I think the reason that we are going to see more, and I'm worried really, that there is a spread, it is going from asymptomatic people. And the best way is every single citizen now should try and get tested so that he knows that he is protected. So I think we have a long way to go in the month of September.
Yes, this is a very important point, and we may have forgotten, and so I want to emphasize on this again. We've had conversations, but it's been a while. The fact that people can be asymptomatic, you could have the infection, you may not know about it, and when you go out and when you let your guard down, not only are you risking you and your family, but also people around you. You could end up spreading the infection further without even realizing it, that you yourself have COVID. A fact that people need to bear in mind. Dr. Gautam Bhansali, good evening to you. Dr. Bhansali, we had a good control over the situation even in Mumbai. The cases had begun to slow down, infection spread had begun to slow down, doubling rate had significantly increased. But again, even in Mumbai, we have seen now in Mumbai and Maharashtra a rise in the daily cases. Now, to what do you attribute this?
See, Tanvi, one thing I can tell you that yes, definitely I do agree that in last 1 week number of cases has increased. But we should not forget one thing, that we have increased the number of testing also. Earlier we used to do 4,000 or 5,000 tests per day. Now we are doing approximately 10,000 cases per day. So if you do 10,000 cases per day, and if you get a number of cases like 1,200, 1,400, 1,700, or today is 1,800 cases. So this is, I feel, not much. Secondly, Mumbai is the city where there is no prescription, no doctor prescription is required for the testing. Anybody can go to the lab, anybody can go and they can do the testing. So that way also people are coming out and they are doing the testing. Third thing, people have the faith that if suppose I come positive, I have enough bed in the hospital. Like in Mumbai, I can tell you today also we have 12,590 beds are available in hospital, and out of that 12,500 bed, 4,800 beds are vacant as of now. As of abhi ki baat bata raha hu, 4,000 beds are vacant. So people have that much of faith, and because of that, lockdown is almost open. So that, and some festivals are also there. So that's why cases have increased. But we have good command on the patients. And earlier the cases was very bad. Patient was very sick, but now cases are very well controlled because of the drug availability is there. Patient come on time to hospital. So things, our mortality rate is also decreased. So things are better. But yes, we are worried about the number of increasing cases.
You say you're worried about the increasing cases. In fact, let me also tell our viewers, while there are still some beds available, regular beds, beds with ventilators also, but because has been a 30% increase in cases in just the last 2 weeks, there is a point of worry even for Mumbai. In fact, even for Maharashtra. In Mumbai, the civic body has already decided to bring in additional beds again at this point of time. So clearly the numbers are telling a story that the experts are looking at right now, and trying to understand what's going on. Dr. D'Silva, let me bring you in as well on this. One aspect is testing. But our own research team has done some number crunching in terms of the daily cases and daily testing we were seeing a month ago to now. And we find that obviously the testing increase is not in proportion to the daily case rise. Would you attribute the rest to unlocking, or is this some amount of indiscipline as well on the part of the people in following rules?
Yeah, hi, good evening. See, if you look at the time from when the first case was detected on 30th Jan in India till 16th July, there were 1 million cases. So it took almost 169 days for the first million. And after that, if you see, the second million took only 21 days. And the third million took only 16 days. Now, it speaks a lot. Why? If you look at the first 169 days, the major part of it was in the lockdown. And hence, the infectivity and the spread of infection was less. Now, once the unlocking has opened, you have the numbers increasing drastically. Like the second million, it took only 21 days, and the third million took only 16 days. And the fourth million definitely will take even lesser than that. Now, the reason for that is indiscipline of the people. The solution for this epidemic, solution for this pandemic is in the hands of people only. The government has done its bit, it's doing its bit. Now, if you look at the government of Maharashtra, it has done an excellent job. Huge number of beds and facilities have been made available. There are 2,000 bedded COVID center at MMRDA. There's one center at Goregaon, one in NSC. So, as far as the treatment part is concerned, definitely there's a good facility available. Medicines are available, but it is the indiscipline of the people. The solution is in the hand of people only, and the solution is only a simple solution, threefold. One is everybody has to wear a mask. There is no solution, no excuse for it. Anybody and everybody, anybody about 12 years of age has to wear a mask. Secondly, a social distancing has to be maintained. If a person is near to a person who's infected, and the longer he is in touch with him, more likely he's going to get infection. So best is have a mask and maintain social distancing. Make sure that your hands are sanitized every time you touch a public place. Now, these simple 3 steps are there. If the people are enlightened enough to follow this, the number of cases definitely will go down. There is no third choice except when you get a vaccine, which again is about a couple of months later. And again, the efficacy and the side effect of the vaccine has to be proved before it can be used. So definitely we are looking at another 3 to 6 months where there is no protection from coronavirus, and the solution is in the hand of the people. People have to get more disciplined, and here the work of the NGOs and the social organizations and the media comes in, where they should enlighten the people that the simple solution is mask, hand sanitization and social distancing.
Yeah, I completely agree with you. And, I feel that it is very important to tell people this right now, as we go forward, because we're going to unlock. We're going to open up the shops, offices.
Yeah, we have to unlock.
We've started our metros as well. People will have to step out. People will have to step out. People will have to be amongst others. But that doesn't mean that coronavirus has gone away. Coronavirus is here, perhaps stronger today than it was in the month of March or April. Dr. Brahma Mukherjee, for a country that is India's size, at the end of the day, it is not surprising that we are the second worst hit country today. Perhaps we'll be on top of that list in a few days, simply because we're such a huge country with such large population. But how do we tackle it? For that very reason, our challenges are also very different from any other country.
Yeah, thank you, Tanvi, for having me on this show. I think what we are seeing is a general phenomenon across the world that we are letting our guards down, we are tired. And in India, what concerns me that we see a classic case of a patchwork pandemic with a piecemeal strategy. And I think that the media has shifted their attention. There is not so much guidance. If I see my own friends and social media, people are having indoor parties again, and the mask is hanging on the shoulder like a necklace, but it's supposed to be always on. It's not ornamental. And I think it's really a joint force where the government, the public, and the scientists have to work together against this insidious virus. And the virus is just waiting for you to let the guards down. And what worries me most, Tanvi, is the desensitization of the general public, that we are having 1 lakh cases and almost, and then 1,000 deaths. And it almost feels like war, that we are sacrificing, we're ready to sacrifice 500,000 people, say, to the coronavirus. It's sort of a fatalistic, destiny-oriented approach that worries me. I think there is a lot to be said about the psychology, and I think we can do better. We are not defenseless against the virus, and the more we open up, actually, if we want to really have the options of the economy and the revival of the economy, we need to really be more stringent with our behavior. The public has a strong role to play in public health.
Yes, and I don't want to create panic or spread panic, but I do believe that it is important for us to have this conversation, to remind people, to remind ourselves why it is so important to follow the rules, why the mask has to cover our nose and our mouth and not really our chin, and why we need to maintain that distance from people even now. I need to take a very small break. I request all of my panelists to stay on with me. We'll come back and we'll talk a little bit more about things that are going wrong in our big cities, in our small towns across the country. Stay with me. Welcome back. We're talking about coronavirus and the sudden spike that we are seeing across the country in the big cities that seem to have a control over the situation. Now again seeing a rise in daily cases. Let me give you an example. Look at the active cases as of September 6th. 8.82 lakh. Active cases as of August 31st, which is a week ago, 7.84 lakh. It's a 12.4% rise in active cases that we've seen in this last 1 week. But if we had to compare it to the previous week and take a look at how week after week the percentage of rise in cases is increasing, that tells you the story. 12.4% rise in cases, active cases last week, 7.35% rise in active cases between July 31st and August 6th. Between August 26th and August 31st, the rise was 8.4%. Between August 21st and August 26th, the rise was 3.8%. So you can see how the pace of number of cases is also increasing right now. What do we need to do? What do we keep in mind as we step out of our homes? That's the question I'm asking. If I can just go across to Dr. Sarin. Dr. Sarin, we also had news coming in today where the Supreme Court asked the center as to why the use of tunnels for disinfecting people had not been banned. The center told the court that disinfection tunnel is actually clinically and psychologically harmful. Now, I thought it's an important point to emphasize and highlight, because a lot of people believe that the minute they go through the sanitization tunnel in their societies, outside shops, especially salons, that all is clear and this works for them. Are we getting it wrong somewhere?
Well, the concept of tunnels was there in the beginning, but then many people found that either people are not following it or it's not that effective. The spray is not that effective. I think what courts and others are requiring is probably safety of their own people. And also, I think judges are more exposed because there's huge crowd in the courtrooms. So I think there is a need that discipline is maintained there. But as I said earlier, the model is of decentralization. I want to explain it again. When you go to a hospital or others, you get a test there, and your attendants can get a test there. But similarly, any other place, you go maybe to your media house and you have 500 people working there. Why can't you just set up a small place, hire 2 nurses, and they can do all the testing there? So the way, if the Delhi is now doing 40,000, can't we make it maybe 1 lakh, maybe 2 lakh? The more you test in the month of September, you would be protected in October and November. When the other infections like flu, like other viral infections will come, and then Delhi will have probably more problems. So I think our time is this month. We need social policing. Policing means you find somebody who's not wearing. Well, you police that. And that other person has the right to police you. And, some times ago, the CDC, the Center for Disease Control in the US, the director Robert Redcliffe said very, very aptly, maybe it was in April or May, that once the winter comes, there could be a second wave. Right now, I don't think we have a second wave, but you may have a second wave. And the second wave will be when you have gone down a lot and then suddenly come up. We haven't gone that up much. So I think we should be prepared for 3 or 6 months from now, not just right now today. And I think we have to realize also, let's say the vaccine comes tomorrow. Who will be getting it? Billions of people are there. So you have to prioritize them. And that's where it is extremely important for us to know high-risk groups, the policies are being made. But people think when the vaccine comes, they will get it. No, it's not going to be that easy. So we have a long way, maybe till the end of next year, maybe another 13, 15 months to go. And therefore, caution is required. We need to understand that, yes, you have to protect yourself and others. Another very important thing is when you go to workplace, please ensure don't eat together. You can smile, but do not laugh together. Do not take off this and shout. Do not make such things, because aerosols can go as far away as 20 feet, while you have droplets which can go for just 6 feet, 4 feet. But when you speak loudly without a mask, that small droplet can spread in the whole room. So especially for teachers, especially for judges, especially for people who have to speak, maybe lawyers, maybe doctors, we see everyday patients, but we ensure N95. There is no shortcut. I'll give you a small data. In the institute, Liver Institute, the positivity rate in doctors is just about 2% have antibodies. Nurses, maybe 7%. But the administrative general staff, the duty staff, 20% had antibodies in this sero survey. It shows that doctors are very careful. They are wearing their mask well. They are protecting themselves well. And therefore, it is important that every citizen understands that protecting oneself and protecting others is the only way. Like the recent Delhi Sero survey shows, every month you have 5 to 7% increase. The first survey in June, July showed 23% were positive. The August survey showed 29%. I have a fear that the next survey data, as and when it is going to be out, maybe you have another 5% increase. So that means still 35% of the population is only exposed to the virus. And 65% is vulnerable. So if 65% is vulnerable, and every month we may add 5% more exposure, silent exposure, not actually sick, even then it will take Delhi to have 70 to 80% that herd immunity level. It may take us several months. So not only for Delhi, for small towns, the philosophy should remain the same. There is no escape. Please understand that the only way out is to not spread and not get infected. Delhi has a plasma bank. Similar plasma banks have come into several places.
Right.
So we have to see patients go early if plasma is
Right,
found
but
to be useful
far
in some
too
cases.
few, Dr. Sarin, right now. The plasma banks are far too few. The support system that we have, if there is a sudden surge in a zone, in an area, in a city, it becomes difficult. And I want to give one example, a case in point here, which is, for example, Pune. Pune, like Mumbai, has been seeing a high number of cases. Even though Mumbai saw a bit of relief in between, Pune continued to see that problem. Now, if you go there, and our reporters have shown this repeatedly, people just don't follow the rules. People don't want to wear the mask. People don't want to follow social distancing. They want to step out. They want to move around, socialize without keeping the norms in mind. Markets are open. Now look at the situation. We are running short of beds in the regular hospitals. The jumbo facility has just about opened. Now the staff at this jumbo facility, and 80-90% of the staff at one of the new facilities has resigned. The medical staff, the medical fraternity is also under pressure. They have been at this job for the past 6 months, non-stop fighting day in, day out. They too are tired, and we have to keep that in mind, because if we let our guard down and if we get infected in a city that's seeing a large number of cases, we will be the one running around trying to look for a hospital, trying to get a doctor, waiting for a doctor or a nurse to come and take care of us. Dr. Bhansali, I'm emphasizing on this because people need to realize, if they feel that, well, yes, the mortality rate is not that high, so what if we get coronavirus? But when it comes to actually looking for a doctor, looking for a place for treatment, it does become a harrowing experience. The medical fraternity itself is stretched and tired and exhausted. So we all need to be in this together, isn't it, Dr. Bhansali?
Yes, yeah, Tanvi, I do agree with you that the system has fatigue. Actually, everybody has fatigueness. Doctors are also fatigued, sisters are also fatigued. But one thing we should understand that if the number of cases get increased, then we already develop whatever infrastructure is required is already developed. Like I can tell you, I visited 3 days back with one of our municipal official to all the jumbo facilities, and we have seen it's a world-class jumbo facilities in Mumbai. They have ventilator, they have oxygenated bed. In Mumbai, total we have 12 jumbo facilities where we are having 13,000 oxygenated bed that is ready. And their staffs are also there, doctors are there. Now, what we did in today's meeting with the municipal commissioner, we attached all the jumbo facility with the medical college hospitals. And with the medical medical college hospitals, doctors will go there. They will take care of the patient. Intensivists will go. Chest physician will go. Other than that, all private hospital in Mumbai, they will take these jumbo facilities and they will treat patient. All jumbo facilities treatment is totally free of cost for the patient. Second thing, all medicines are available in all the jumbo facilities. All kind of investigations are available, like interleukin 6. You will get in 15-minute result. 15 minutes only. You will get rapid antigen test. You will get RT-PCR test. All kind of tests are available in jumbo facilities. All kind of doctors are available. Private hospitals, private doctors are also participating in jumbo facilities. So I can assure you that in a few days only, and we have 1,200 ICU bed in jumbo facility with ventilator. We have world-class ventilator with world-class ICU bed in Mumbai in jumbo facility. So we should not fear it's a free of cost or junior doctors are there. That's why it may be good or not, or quality-wise some compromise. No, it's a world-class facility with good medical college hospital. Doctors are there. With private hospitals, doctors are also available there.
Right.
So things are good. Beds are available. Oxygenated bed are available. And ICU bed are available with the ventilator. We should not have that much panic. No, if cases will increase, then what we will do, where we will go, who will take care of us? No need to be panicky. But we should take enough precaution as Dr.
But Dr. Bhansali, where is the staff?
Staff is there. Staff is available.
You can increase the number of beds and ventilators.
Yes, we increase staff also, we increase nurses also. We call nursing college third year students also, because they are just exam going students, just like their DM and MD students are there. They are exam going students. Their exams have just they have just given the exams, and they are now free. So we just deployed staff like medical students, MD, DM candidate, final year students. They are nursing staffs are there. They are just for the exam going, and they have just come. Professor, we have applied today only in our Zoom meeting with the municipal commissioner. It's all done. So staffing, yes, few days back problem was there. Now problem is sorted out.
Okay, let me
In that,
also bring in our other two panelists. Dr. Vijay D'Silva, I want to come to you next. Yes, Dr.
Yes.
Vijay D'Silva, if I can just come to you about this, one thought that people have in mind that they're going to step out, they will wear a mask. When you step out, you use a sanitizer. If you're entering a shop, you use a sanitizer. They ask you to use the sanitizer again, and then you come out. But is that going to be enough? People often forget that they're touching surfaces, they're touching objects. The hand, invariably will go to their face. They touch their face, head somewhere. What are the precautions we need to take as we go about living our life normally while following the rules?
Yes, see, the corona is going to be there for some more time now. The only thing is that we have to take care to prevent getting infected. As it is said, prevention is better than cure. Now, Dr. Bhansali has said that all facilities are there to treat. I agree with him. Government of Maharashtra has done a good job. There are good facilities to get treated, but it is better and it is smarter not to get infected. And not to get infected is very easy. Now, life has to go about. The economy has to open up. You can't keep the lockdown on all the time. So life has to go on, and people have to move out. But people should remember that if it is not necessary for somebody to move out of the house, they just stay inside. People who are working, they should try to work in such a way that they maintain social distancing even at work, even while they're having a break, even while they're traveling. Everywhere the social distancing has to be there. There's no two choice about it. Mask is mandatory for everybody. Now, mask, there's a misconception that if you wear a mask, you're not going to get infection. The mask is for everybody, so that people who are expelling virus, so that they don't expel. The reason for people to get infected is very much also dependent on the amount of virus entering you, what is known as minimal infective dose. So the severity of illness, if you see, varies from people who are asymptomatic to people who are severely ill. Now, depending on the dose of the virus, if the dose of the virus is more, you're going to be more sick. Similarly, if the expulsion of virus in the air, it is more when somebody is talking, somebody is shouting, or somebody is singing, or talking itself, or coughing or sneezing. So if somebody is wearing a mask, the amount of virus expelled in the atmosphere is very less. So 100% implementation of face mask covering the nose and the mouth has to be there. That is the minimum simplest way to prevent the infection to be in the air and for people getting infected. So people have to take this much definite precaution and go about with their routine life.
Because you and two of our panelists this evening, Dr. D'Silva, have said this, that when you talk loudly or you sing or you shout, that makes it even more potent and dangerous. Clearly, shouting anchors in studios is not something we should be looking at right now at all. Or in any other situation. But that being said, very quickly, if I can just go across to Dr. Brahma Mukherjee. Dr. Mukherjee, the other aspect, and I spoke with Dr. Guleria as well on this, is the point of reinfection. Are there more cases we're seeing across the world, which would then put a big question mark on the kind of vaccine that we actually need to deal with coronavirus?
So one thing I would like to mention is that there have been sporadic cases of reinfection reported all across the world, but the number is really, really small. And most of the time, as my previous panelists mentioned, that it was not really a full recovery. So that makes me if there are three things that I want to see as an epidemiologist and someone studying the disease transmission, one is really a national recovery cohort. Each and every person who have been declared to be recovered, really a long-term follow-up study, because there are studies all across the world showing heart anomalies and various other complications long term. So we really need to establish a follow-up cohort. And maybe when they're being invited for plasma donation, we can run some simple tests on them to make sure that they are doing okay. So the alarming thing is the number of cases, but the reassuring thing in India, which has always been reported, is the low mortality or the infection fatality rate. So these seroprevalence surveys are great, which are showing us that in cities, but we really need a population-based seroprevalence survey as well. And maybe with that, we can tag on some diagnostic tests so that at a snapshot, we can also get a population-based sense of the true prevalence of the disease. So these type of data will make us feel a lot better. And we definitely need to study more as scientific community, the ephemeral response due to antibody versus the long-term response due to the immune cells, the T-cell immunity that was talked about. But finally, I think that as a humanitarian, as a citizen of the world, I'd like to say that we are all tired, but, collective sacrifice, social responsibility, vigilance, these are lofty words, but whenever humanity has faced a crisis, we have needed that for human beings. So I'd really like to emphasize on that.
Well, thank you so much for that, and I think that's a good note for us to even wrap up this conversation for tonight. We will continue to have lots more. Thank you to all of our panelists for joining us right now. Viewers, very simply put, Maharashtra has seen a rise of 100% in its daily cases. Testing has only gone up by 22% in the past 1 month. For Delhi, the rise has been 150% in daily cases. Testing has gone up by 76% in the past 1 month. Kerala has seen a rise of 137%. Testing has only gone up by 65% in the past 1 month. And I can go on and on, state after state after state in the big cities. The trend is the same. It's because you and I are feeling tired, are feeling as if we are done with COVID. We don't want to follow the rules anymore. And that is going to be our single biggest mistake. We cannot let this disease win. And the only way for us to continue winning this battle is for us to follow the rules. Wear a mask, sanitize, and maintain social distancing. Thank you so much for joining us on this conversation.